That's my biggest concern is, is budgets will get dried up, and then there will be no budget left to go back to these other conditions, the research into these other conditions. And so then they are faced with making these very challenging trade-off decisions of essentially which disease deserves it more, which is always a challenge, but the challenge become more stark given that all the budget is going to be given away to coronavirus research. The government budget started to get funneled to support research, obviously, but you also just saw a lot of organizations decide that they were going to independently tackle their own research into the space. And then the medical community itself is all trying to help each other understand what treatments have worked. It's sort of literally in the hospital, in the system, and then they want to tell others about it. So each parts of the system, let's say, think of the government as one part, they've made a conscious choice. The medical system is kind of made the choice out of necessity. And I think the private sector has made the choice, I think, just out of the combination of both, the clear need and conversations with government, as well as just the opportunity to solve what's clearly a big problem. So I don't view it as an order of operations, but each of the major sectors have gone into the coronavirus research for slightly overlapping but different reasons.
And how does a course correction sort of start to take place? Are we going to have to start seeing stories of human suffering, caused by these disruptions in medical research and care, or do you think that the alarm has sort of been sounded and we're going to see a course correction sooner?
It's hard because the course correction is going to be hard for those alarmist reports because it's really a counterfactual. And by that I mean, boy, if we had research, we would be further along in treating this other disease. That's hard to prove and to know. So I think my guess is what will happen, and I am speculating here, is once we get past we have a vaccine, then there'll be a whole cluster of stories about patients who were obviously delayed in treatment, delayed in diagnosis, and then you'll start hearing from scientists who said, yeah, my research was delayed by a year or two. I'm afraid right now, because the coronavirus is still the topic, that those stories would fall on deaf ears. And then in a year from now, we're going to hear a big cluster of those type of stories. And that will be upsetting. I think the question is, would people do anything differently now because coronavirus is such a problem? I'm not sure people would make a different choice now, even if they really think about the opportunity cost of what we're working on.